When a politician says that low-income Americans need to prove that they work in order to qualify for Medicaid, it may sound reasonable, but this is the exact opposite of the goal of Medicaid, which exists to get people health coverage, especially those that need it most, like the elderly and the disabled, not to promote work. It is not a jobs program. And in fact, the majority of Americans on Medicaid already work. But the new Medicaid work requirements from the Trump administration that will go into effect in January of 2027 are rife with bureaucratic hurdles and technological gaps. These are all in an attempt to require certain enrollees to prove that they're either working, participating in activities like community service, or enrolled in a work or educational program for 80 hours a month. Let's be clear, this policy isn't designed to get more people working. It's designed to ensure people lose their health coverage. I spoke with Gelia Selassie, a director at the Justice for Aging, a national organization focused on fighting senior poverty. There's a stereotype that able-bodied young men are getting Medicaid coverage instead of working. Can you debunk this for us?
That stereotype grossly misrepresents who relies on Medicaid. It is a lifeline across the aging spectrum, from children, people, adults with disabilities, older adults, pregnant women, all over the place. Nearly a quarter of Medicaid enrollees are actually 50 plus. About 65% of Medicaid enrollees are working.
People with disabilities can get an exemption from work requirements, but the process is so fraught and so administratively burdensome that it can be literally life-threatening, according to Selassie, who worked as a legal aid lawyer in North Carolina.
I used to work in a state that didn't expand Medicaid. So, in order to get Medicaid, they had to prove that they were disabled. I had a gentleman who had diabetes and he was a rideshare driver. Because he didn't have health care, he needed somehow to find medical records and have a clinical assessment and physician notes and everything like that to give to the Medicaid office to show he's disabled, but he doesn't have insurance to do it. So, he had to use the emergency room. He had to pay out of pocket what he could for his diabetes medication and ended up trying to chop them up to make them last longer, rationing them out. Occasionally, he might try to spring together some funds to pay out of pocket for a specialist. But eventually, this process ended up taking 8, 9 months for him to get on Medicaid. And unfortunately, at that time, his diabetes had progressed to the point where he had vision loss and other symptoms that made him not being able to work at all. So it's just this really impossible scenario that people are in. And they're in this scenario for needing something as important as cancer screenings, as prescription drugs, as mental health services. These aren't luxuries. These are really crucial lifelines for people.
By forcing people to prove their community service or work hours, it's more likely that they will just be kicked off the rolls, not just due to clerical errors, but technological challenges. The best the federal government can do right now is to, quote, pilot technology to help people confirm their work hours, as CMS Administrator Dr. Mehmet Oz said in August.
We have technologies now, and we've invested already, as soon as the bill was signed, began pilots to try to demonstrate that we can actually do this correctly. You didn't work enough, but we can actually help you by connecting you to your employment office.
So you're still figuring out the technology.
Do you see a technology solution that can actually work for Medicaid beneficiaries?
The short answer is it's not very likely. As you mentioned, a couple of states tried doing Medicaid work requirements during the first Trump administration, and for a variety of reasons, either through the courts or anything else, it didn't pan out. But during the short period they had it, their websites would literally shut down. Like it would not even, it would overwhelm. Like the website would just close at 7 p.m. or 8 p.m. at night, as if, it was a business or something locking its doors. So people couldn't even log in their hours. On top of that, even if the technology is somehow guaranteed to be absolutely perfect behind it, you're talking about a very indigent, low-income population that doesn't always have access to smartphones, that oftentimes only must utilize public libraries or other community resources to use the internet. And so you're creating a system, this app-based system, for a population that might not be able to afford it or access it easily. On top of that, again, most Medicaid enrollees, they might be older, they might be disabled, they may have like limited visual acuity, they might have limited dexterity with their hands. And so making apps aren't generally accessible either when you're talking about a population, even if they can afford the technology. When these requirements were put into place, it created as much of a burden as it was on the individuals who were losing their health care, it created a massive, massive burden on the state. Tens of millions of dollars were going to these DC-based third-party contractors in order to implement it, instead of going into the healthcare of the individuals so they can live long and healthy lives.
For example, Arkansas spent $24 million to implement work reporting requirements, and Georgia spent $87 million to do the same. This money could be better spent helping people actually get healthcare coverage, not proving that they're working. Again, this is the purpose of Medicaid. It's not a jobs program, it's a health insurance program. Kevin Liban, a former legal aid lawyer who successfully sued to stop Arkansas's Medicaid work requirements, explains.
I worked with literally hundreds of people during that time, and my team even hundreds more. One name really sticks out, and that's that of Adrian McGonigal, who was one of my clients. He had just gotten the best ever paying job of his life. He started working in a poultry plant. I think he was earning $12 an hour, $13 an hour. It wasn't much, but it was better than anything he'd had before. And Adrian had chronic obstructive pulmonary disorder, COPD, which makes it really hard to breathe. And in the poultry plant, you're exposed to all sorts of chemicals and dust and chicken feathers and these kinds of things. And so he really needed his medication to be able to stay working. What happened is he got caught up in the, in the work requirements trap. He lost his coverage. Within a couple weeks of losing his coverage, he ran out of medications. Once he ran out of his medications, he couldn't work anymore. He ended up in the ER several times in the course of a few weeks. Every time he'd be discharged, he'd come back, try to work, but couldn't. Ultimately, his employer had to let him go because he just couldn't do his work without his medications. So he lost that job. He would end up unemployed for a long time. When he finally got stable, after we got involved and were able to get his Medicaid back, all he could find at that point were, low wage, minimum wage, fast food jobs. And he never really got back fully on his feet again. And sadly, Adrian passed away about a year ago. It was his loss of Medicaid that kind of started the downward spiral.
Is it fair to say that work requirements are unnecessary?
They are wholly unnecessary. Again, you've got nearly everyone on Medicaid already works, has a disability, has caregiving responsibilities for kids or aging parents or other folks in their family, or is going to school. So everybody's already doing the best they can with what they've got. Work requirements don't produce any value, right, at all. There's no increase in employability in any sense of the word.
With a loss of coverage comes instability for millions of Americans. As Kevin said, everyone is doing the best that they can. And now they'll be penalized for trying to better themselves and their families, all the while just trying to keep their coverage.